Welcome back to Wake Up with Cheddar. Vave Health is revolutionizing the ultrasound, the medical device company pioneering the very first wireless pocket sized ultrasound, transforming the commonly used medical device into a more accessible device for providers, patients, and today's rising medical professionals. The device called the Vave Probe has now been rolled out for medical students at Turo's University, Nevada. Amin Nikoozadeh, the founder and CEO at Vave Health, joins us now. Amin, great to have you on. Can you tell us how this handheld ultrasound works? What are some of the features?
Yes, thank you for having me on. So what we have done is miniaturized basically what is typically a cart-based big ultrasound system that people roll around in the hospital rooms and clinics. And we've miniaturized it into a ultra portable wireless handheld unit that basically has all of the hardware accessories or hardware needs of performing an ultrasound exam. And this device, as an accessory, wirelessly pairs with my smartphone or my tablet. And I have an app that is running here and is able to process the data that is coming from this probe to it in real time. And it basically turns your smartphone into an ultrasound imaging device.
How do you envision this being used? Is this for regular people? Like if you're pregnant in your home, is this something that you would use and send to your doctor? How do you expect this is going to be used?
So it certainly is what I believe and what we believe is the path for ultrasound, that it's a safe and real-time imaging modality that it provides a lot of information for the human body. And what we're set out to do initially is to empower physicians, to allow doctors to have the best tool in their pocket, which we believe the era for stethoscope has been there for a long time, for 200 years, over 200 years. And they need a better tool to visualize what is happening inside human body. And that's the first step. And our first goal is to bring ultrasound to the mass use by all healthcare professionals, doctors, nurses. And eventually we'll get to a place where ultrasound can be used by the end users with the help of the physicians. And that's where there are a lot of different things that have to come together for ultrasound to become an autonomous tool. Imagine being in your house and as a pregnant family that you will be able to put an ultrasound probe and that system to be able to guide you to capture the right images and only be called in to the hospital if there's any need for you to be in that hospital setting, and otherwise the care to be provided in your house.
As we mentioned before, Vave recently partnered with Turo University in Nevada. Can you tell us a bit about that type of partnership and how it works?
Absolutely. So one thing before I say that, I think that our goal of, again, bringing ultrasound to the mass use by doctors, everything starts from our view from medical education, medical schools. And for this tool to truly become standard of care, we believe that medical students have to grow up with it. And this is something that we share with a lot of medical schools that are pioneering the use of ultrasound, including Turo. And that was basically very much aligned with our mission to start early on and to allow the physicians of the future to basically learn what ultrasound can bring to their clinical practice. And another thing that we've done specific to medical education is that we're integrating not just ultrasound, but also content and material that would allow students and the teacher to be able to learn their anatomy, the other courses a lot better, because now, again, you're able to see how this heart is beating as opposed to just looking at 2D images. and one-dimensional images or two-dimensional images in a book or digital, you can actually see the heart beating. And we find a lot of values, and some of the partners and medical schools that we're speaking to and talking to and we're partnering with see a lot of value in now equipping every single medical students of theirs with an ultrasound system of Vave.
Right now, Vave operates under a subscription model. Can you explain that a little bit?
Yeah, so that's actually something that we're very proud of, and what we call as ultrasound platform as a service. We are not providing an ultrasound probe in a nutshell. What we're providing is a whole ecosystem and a whole platform. And what we mean by that is you are in a way paying as you go on a monthly basis, and a very inexpensive and accessible number, which was what we set out to do from the beginning. For $99 a month and basically less than a cup of coffee a day, you're able to have access to imaging. And that access to imaging is our hardware that comes with that subscription, is the access to our software that is ever evolving, which is an incredible point. With software as a service, we all got used to an ever evolving software that doesn't stay stagnant. It evolves over time. And same thing applies here. In our scenario, that we are evolving the software as it gets better. We're evolving our artificial intelligence that is running on your smartphone to give you better and more information every single day. And not only that, we are introducing something that has never been done before in the industry, and that is ever evolving hardware. So as part of that membership, every 2 years, as the technology evolves and as this product gets more and more capable, we're upgrading basically the user's hardware piece. And that's what we were so proud of, and we call this platform as a service. And again, for a very low monthly cost, people can have access to a technology that is never obsolete.
Yeah, definitely revolutionizing ultrasounds. Thank you so much, Amin Nikoozadeh, founder, CEO at Vave Health. Great to have you on. Appreciate it.